Welcome to part two of home health care with Nurse Linda. Senior moment with Nurse Linda. This is Dr. Charles Campbell, the man behind the camera. And you notice how steady that is. It's a steady hand. It's actually a good tripod. And that's Nurse Linda. We're talking about home health care in part two. Again, thank you for writing in. Thank you for calling. Go to our website at brookhc.com. It answers a lot of the questions. Not that we're not happy to talk to you, but you send in an email, we've got a record of it. We know who to get back to. And home health care is getting bigger.
And it's going to continue to get bigger with the boomers aging out.
And what age are boomers?
Boomers started aging at 65 in 2011.
Oh, really?
Yes.
Am I a boomer?
Yes, you are. I am too.
Are you really?
I'm in that group, yes.
Wow.
Yes.
Nobody, I didn't sign up. I don't have an ID card. I really don't know.
I think it should be a club. Absolutely. We've been called boomers our entire lives, and it goes from, depending on which resource you use, 1946 to 1961, although some people say it only goes to 59. So in that time frame somewhere, but
Okay. Boomers are us.
Yes.
Website, yeah. Now, most of the questions we get are how can I make sure that this will be okay for my parent or my loved one?
Mhm.
What is healthcare quality? What's quality care for healthcare?
Well, and a lot of quality care means giving you the type of care you expect, very similar to the type of care you would provide for your loved one at home.
Well, it's an important purchase when you buy this kind of service.
Absolutely.
Talk to friends, neighbors, and your local area agency on aging. They
Mhm.
have questions and answers to learn more about the agencies in your community. Now, Brook Healthcare is an accredited agency.
We are listed with the Alzheimer's Association, with the Office on Aging. We are also Medicaid certified, which is a process, and that kind of gives us a little bit more credibility because we've had to go through quite a stringent once over, twice over, thrice over
Yeah.
to get through that.
You're accredited by the American College of Home Health Care, of
Yes.
which you've been elected fellow
Yes.
last year. I think
Last
it
year,
was.
yes.
And if there are qualifications out there, you've got them.
Yes. Yes. And there's a new licensure coming through DHEC, the Department of
that's
Health.
going to affect a lot of these mom and pop agencies and
It's
people
going
with
to
this.
affect a lot of agencies like this. Up until this point, we have not required a state licensure for providing home care. They are now working on defining what those guidelines are, and we'll be applying that to agencies. We're not going to have a problem. We're meeting or exceeding all of their proposed guidelines so far.
Well, you're involved with that, so you would know what the
Yes.
qualifications are.
Yes.
Now, you want to know how long has the agency been serving the community, and also you want to know who's running it, a CPA or a nurse or a doctor or medical personnel.
Well, and that's one of the requirements that's going to be coming through DHEC, that a nurse is on staff somehow in some capacity to be allowed to be seeing the patients and following up or being available for consultation. So, but we're owned, run, managed by nurses. Our agency has been functioning now for over 4.5 years, but most of my 34 years in nursing has been in home care. So the agency itself may be a little on the new side, but we are not new on experience by any stretch of the imagination.
No, not by any. Your medical tech. What do you call it? Not EMT.
EMT.
EMT. Okay.
Yeah, as well as an RN. So I've kind of seen a whole bunch of different things over time. And I've seen employees try to get away with a lot of different things. So we've kind of stopped that when we're hiring, and we've put some very stringent guidelines into place.
Oh, I've listened to your interviews. They are very stringent. And you hire what's called LMAs. That what is it? CNAs.
CNAs, yes. CNAs as well as PCAs which is personal care assistant, with very well documented experience. But mostly CNAs are who we have here, along with LPNs, RNs. We try to cover the gamut of a little bit of everything, and make sure that people are well taken care of. But we have a very strict screening process. And part of that is we do, like many agencies do, I'm not going to say all of them do because I know they don't, we do a criminal background check.
That's right.
And that is a nationwide check that checks back at least 10 years. And actually, our check goes back further than that. We've had things come up on people 20 and 25 years ago.
Really?
Yes.
How do you do that?
It's a service that we use. And some people, you can set it up with some services, you only want to go back X number of years. And we said no, because we want to know a full history behind people and what they do. The other thing, and we look at that very closely to see exactly what kinds of things may pop up on that, because some of them are silly. It's not a big deal. But what we also do is we take a second step, and we also do a driving record check.
Now that's important.
That's very important. Number one, these are people who are potentially transporting our clients from physicians' offices to shopping, etc. We want them to have good driving records. But it also tells a lot about that person. We've had people come in who their criminal record is perfectly clean, but their driving record is atrocious. For silly things, multiple speeding tickets, multiple no seatbelt violations, multiple no-show in court for those silly things. What that tells me is that person may not be a person who likes to follow the rules.
You think?
And that tells me a lot about that individual. Even if they come with a stellar work history and a clean criminal background check, I'm still very hesitant and usually do not hire that person.
Sounds like our lieutenant governor, the former. Yes, I'm only
So-
going 90 miles an hour down Main Street.
Yeah, so we're very careful that way. We also go through the process of not just checking the references that the individual gives us, but we check work history. And it amazes me at the number of people who rely on their work history. And I don't know why that surprises me, but it does. I don't understand that they don't realize that we aren't going to call BILO to see if they work there. If they told us they work there, then we should be able to, the dates might be off, you know, the name of the supervisor might be different now, but it's still something that we can check. So, and if they lie on that, lying on an application is immediate removal from this whole system. We don't even process the application any
You get a
further.
lot of that, don't you?
A fair amount. Fair amount.
Now, I know for a fact that other agencies don't go to this extent. Some do.
Yes, some do. Yes.
And I can't say most don't because I've talked to most people. But you get people in here that I don't know how they get a driver's license, let alone anything else. Are they in here just because they're applying for unemployment benefits someplace else, and they have to come in and show they're looking for a job? They do that.
Sometimes that happens, and we can pretty much spot that fairly quickly too, especially when they give a work history and they're hopping from place to place to place. That tells me that might be an issue as well. Even if they get a good reference from that company, it may still be a problem. We don't want somebody who's only going to be with us for 3 months and leave again. We want someone who's interested in staying and growing with us because we invest a lot of time into these people. These young men and women who come to work for us, they're put through a very stringent question and answer period. They have to demonstrate their skills for us. Then when they're in the field, I'm following up with them. I'm watching them give a bath. I'm watching them do vital signs, prepare a meal. They have to also complete regular in-service training with us.
Yeah, American College has training that they have to go through,
Absolutely.
and they certify home health care people.
Yes. Yes.
So I would feel comfortable having you look after my wife.
Well, thank you.
Yes, I would. But she's in extended care now, and that 24-hour day service she needs.
We also take very seriously any concern anybody has about an employee.
Oh yeah.
And it happens, especially these young girls, oh, she's on the phone all the time. Well, that will only happen one time. And we will follow up to make sure that that changes. If it doesn't change, that person's out.
You're listening to Senior Moment with Nurse Linda. Our phone number is 803-941-7231. That's 803-941-7231. Web address, brookehc.com. Oh, and that's the med center about my wife. We'll be back right after this.